Well, hey everybody. This is Sherman, and thanks for being here with me today. I'm actually using a new video way of playing with the video, and we're going to talk a little bit today about this healthcare debate. And it's something that I don't think I've not heard anybody speak about this yet. I've heard um, all of the pundits talk about the way that people aren't going to be able to afford health insurance, and how there's going to be mass rioting in the streets, that healthcare will be long lines and everything else. But the one thing I don't think people are really realizing is that there is a whole industry that is built around the healthcare industry and how that's going to affect the healthcare industry as a whole and its peripheral people, especially insurance agents. So let's back up a little bit, give you kind of a recap of what is going on here, and we'll actually kind of give you what I'm talking about. Um, President Obama has been really pushing to have the healthcare in the United States become socialized. The thing that they call the public option, where the government basically gets into the healthcare business and provides healthcare to the people who they feel have not don't have health insurance at this point. And the number that they record is upwards of 14 million people in the United States who don't have health insurance. Now, whether they're counting illegal aliens, or whether they're counting just people who decide not to have insurance, they're under 25 years of age, and they decide that, hey, I'm not going to worry about health insurance at this point in my life. I don't know where they get these numbers from, but the fact being is that they're saying, as the Obama administration is saying, that these people do not have health insurance. Now, Hillary Clinton, who is now Secretary of State, tried to do something similar, where she was trying to bring in health care insurance to everybody in America during the Clinton administration, but that fell by the wayside. Well, in this latest barrage of bravado, the Obama administration has railroading, I mean, just ramming through this legislation along party lines. No Republicans voting for this legislation, and they're saying, hey, we are going to make this happen whether you like it or not. The polling data right now says, hey, guess what? This is not what we want. There's a majority of the people say we don't want this, but the legislators and our congressmen are going back saying, you know what, we are going to make you have this anyways. Well, unfortunately for these politicians, they've got a rude awakening when they get back home, especially you, Harry Reid, because guess what? There are many people who are calling for their heads, and they don't want them in office anymore. A lot of chicanery has been going on, a lot of backdoor deals are going on, a lot of pork is being thrown around. A lot of people are pretty upset about this whole situation. Anyways, okay, so that kind of gets you caught up with this whole healthcare debate. But the thing that is going on right now that I don't believe that has been covered in this whole debate has been the fact that there are people who are whose jobs it is to sell health insurance, and how those jobs are going to be affected by this government-run health industry now. If the government gets, let me give you a for instance here, guys. Let's say I work for XY insurance company, and my designation is to sell health insurance. That's what I do. I don't sell auto insurance. I don't sell home care. I don't sell businesses. I don't do any of that insurance. I'm not commercial. I do health insurance. One bank in, or excuse me, provider. His name's the name of it, I think, is Bankers Life. All Bankers Life does is sell insurance to the elderly. Okay. Let's see what happens now when an employer says, or the government gets into the business of selling insurance, and there's an option now to say, okay, shall I insure this elderly person, or shall I allow the government to do it and get them off of my rolls? Okay. Well, if people have the choice, guess what? If a business has a choice, you know what they're going to say? Hey, I'll take the fine that I'm going to have to, that I would be imposed on me, and it'd be cheaper for me to get the fine and allow the government to pay for this person's insurance. Okay, now that insurance salesman who comes to say, okay, now I'm coming to you, elderly person or person who's over 55 years old, and I'm coming here to sell you insurance. Guess what? Now that job is gone. Well, the Obama administration has said that, hey, our policies are going to help either create or save 3 million jobs. Well, I can tell you right now, if you have your way right now with what you're implementing right now, can you imagine 100 people in each township whose jobs are to sell insurance? Can you imagine 1,000 people in each state? Multiply that by 50. Now you've probably got closer to 50,000 people who are not going to have jobs as a result of this particular, just this one piece of legislation in this one little sector. 50,000 people, jobs that are going to be lost. Okay, so I know what you're saying to yourself, it's only 50,000 jobs. Well, no, it's not. It's more than 50,000 jobs. Those 50,000 people who were breadwinners now do not have jobs, and guess what? There's a ripple effect on this whole thing. They used to frequent restaurants. They used to frequent, because insurance people generally make fairly good money. Okay, you can make 6 figures as an insurance agent fairly easily. Now, these people aren't buying cars. They're not buying food at the grocery store. They're not going out to buy those big ticket items that they normally would buy. Folks, this is going to have a ripple effect down the way, because the government says, guess what? We are going to make you have something that you don't want to have. This is getting ridiculous. I don't think people are really thinking of the fact that, guess what? There's a ripple effect to everything. Yes, there is a problem with the health industry. I'm going through it myself right now. I was hit by a car back in January, and now I'm suffering for it here in December. I've been going to doctors since November for something that it was just something fairly simple, and I'll be going to doctors well into January to try to get this solved. Am I happy about it? No, I'm not. But guess what? The alternative is long lines. The alternative is maybe no coverage at all, or not have my body worked on at all, because it doesn't the government might say, hey, I don't think you really need that surgery, or you know what, that's a little bit too expensive. You're not as productive anyways as you could be. Who is to decide these things, folks? This is still America. This is still a land of the free and home of the brave. Okay, this is not communist China. We need to begin to look very seriously at a pushback movement in America, you guys. Contact your senators, contact your congressmen, let them know, hey, guess what? This is not the right policy for America. I'm a Christian, I am a conservative, I'm a liberal, I'm not even a liberal, I'm an independent voter. One thing I understand is finance, and one thing I understand is that there is a ripple effect to everything. Have you, Mr. Obama, did you notice that there is a ripple effect? You might have grandiose dreams and grandiose visions, but one thing that you cannot tell us is that what you're going to do is not going to affect everybody in America. I really admonish you, sir, to think about this. This is Sherman Ray, and I hope you've enjoyed this. I'll be back on probably the next couple days to do another segment, and you guys be blessed, and we'll talk to you later. Okay? We'll talk to you later. Bye-bye.